Have you ever wondered why some men, as they grow older, find themselves unable to ejaculate sperm during climax? It's a question that may make you feel uneasy or even uncomfortable, but it's one that many men silently face, and yet, it's rarely discussed openly. Aging brings many changes, and this one is often met with confusion, anxiety, and even feelings of shame or isolation. But today, we're going to dive into a topic that not only needs more attention, but also deserves to be approached with honesty, understanding, and compassion. This video will shed light on why this change happens and, more importantly, why it's completely natural as we age. Spermless ejaculation, often a result of conditions like retrograde ejaculation, is not a sign of failure or a medical emergency. It's simply a physiological shift in your body. Whether you're in your 50s or beyond, knowing more about these changes can help ease any anxiety you might have about your sexual health. As we age, our bodies go through transformations, some of which affect our sexual function. These changes don't have to define you or your relationships. By the end of this video, you'll understand why this happens, how common it is, and how to approach it with confidence and dignity. It's time to challenge the stigma around aging and sexual health and foster an open, empowering conversation. Stick with us until the end for valuable insights on how to navigate these changes and embrace your health with understanding and peace of mind. If you're ready to face the natural changes of aging with knowledge and confidence, keep watching. Let's break the silence together, and by the end of this video, you'll have a deeper understanding of your body and its remarkable ability to adapt. If you haven't subscribed to our channel yet, I encourage you to click the subscribe button and ring the notification bell to stay updated on all our latest content. I'm eager to hear your thoughts on today's topic. If you enjoy the content, please comment 1 below. If it doesn't resonate with you, leave a 0. Your feedback is crucial as it helps me create better videos that align with your interests. Now, let's get started. Today, we are diving into a topic that, although it may initially seem uncomfortable or even taboo, is one that holds profound significance for many men and women, especially those over the age of 60. It's a question that might make you feel uneasy, but it's one that needs to be asked. Why is it that some men, as they grow older, find that they are unable to ejaculate sperm when they climax? While it's a deeply personal concern, it's one that many men silently struggle with, yet it is rarely discussed in open, candid conversation. This silence is, unfortunately, often rooted in societal taboos surrounding aging, sex, and our bodies, which causes confusion and, for some, even feelings of shame or isolation. But the truth is, it's time we address this issue with the compassion, honesty, and understanding it so truly deserves. It's perfectly natural to feel discomfort or even embarrassment when discussing such a personal, intimate subject. The very nature of this topic can feel vulnerable. After all, our sexual health is something that often feels so private, so wrapped up in our sense of identity. However, it's essential to remember that these physical changes, though deeply personal, are simply a part of the aging process. As we grow older, our bodies undergo transformations, some of which affect our sexual health and function. These changes, though they may seem unsettling at first, are not signs of failure. Instead, they are the natural result of our bodies evolving as time passes. Understanding this shift is vital in freeing ourselves from unnecessary anxiety or distress. Spermless ejaculation is simply a physiological change, and in most cases, it does not indicate anything medically dangerous or urgent. In fact, it is nothing more than a normal, albeit sometimes surprising, part of getting older. For many men, it is typically after the age of 50 that they begin to notice subtle shifts in their sexual health. It's during these years that many men may find that their bodies no longer function in the way they once did, including in their sexual experiences. This doesn't mean that men under 50 are exempt from these issues. They may experience them earlier, and this discussion can still be of value to them as they approach these years of life. Aging is not something that can be neatly boxed into a certain age bracket. We must remember that the wisdom and maturity gained through the years enable us to approach these topics with grace and dignity. The cultural stigma that often surrounds aging and sexual health must be dismantled. This isn't a topic that should make us feel ashamed. Rather, It is a conversation we should approach with the same acceptance and respect that we afford any other aspect of our well-being. These changes are not failures or deficiencies. They are natural milestones in the journey of life. The key here is to understand that these changes are entirely natural, and that there is no one-size-fits-all explanation. Each individual's body ages differently, and the way one person experiences the passage of time may not be the same as someone else's. The changes one man goes through in his 60s may not mirror those of another man of the same age. This unique journey through aging is something we should honor rather than fear. One of the most common explanations for spermless ejaculation is a condition known as retrograde ejaculation. While the term retrograde ejaculation may initially sound alarming or even scary, it is far more common than many people realize. In essence, retrograde ejaculation occurs when the semen, instead of being expelled through the urethra, is redirected back into the bladder. This might sound unsettling at first, but it's important to understand that it is not a harmful condition and does not pose a significant health risk. The underlying cause of retrograde ejaculation is often related to changes in the muscles and nerves that control ejaculation. As we age, these muscles naturally lose some of their strength and tone, which can result in the semen being directed into the bladder instead of being expelled through the urethra. This is simply a natural and non-harmful change that many men experience as part of the aging process. It's not something to be feared, but rather something to be understood and accepted as part of the broader changes our bodies go through as we age. The impact of retrograde ejaculation, while it might feel confusing or unexpected, is minimal in terms of its long-term health effects. However, it can understandably cause distress for men who are not familiar with the condition. The fact is, retrograde ejaculation is rarely a sign of a serious underlying medical problem. Rather, it is a normal response of the body as it adapts to the natural aging process. Just as we experience changes in our hair color, skin elasticity, and energy levels as we age, so too does our sexual health undergo shifts. These changes do not define our vitality or worth. They simply reflect the ongoing process of growth and adaptation that is intrinsic to the human experience. It's also important to remember that, while retrograde ejaculation is one of the most common causes of spermless ejaculation, it is not the only one. Each individual's body is unique, and there may be other factors or conditions at play that influence this experience. For example, certain medications, medical conditions, or surgeries can affect the function of the muscles and nerves involved in ejaculation. However, it's essential to understand that none of these changes necessarily mean that a man's sexual health is in jeopardy. Instead, they are simply part of the intricate and often unpredictable nature of the human body as it matures. If you are still watching this video and find these lessons useful, please comment number 1 below to let me know that you are still watching this video with me. The more we talk openly about these changes, the more we reduce the stigma and allow others to feel supported and understood. There is no reason to hide in shame or embarrassment about these natural processes. We are all in this together, experiencing the same challenges and changes that come with aging. With each conversation, we take a step closer to normalizing these topics and providing the necessary education and reassurance to those who may feel insecure or anxious about their bodies. Aging does not have to be a source of fear or shame. It can be a time of embracing the wisdom, understanding, and growth that come with the years. Let's shift the narrative from one of discomfort to one of empowerment and acceptance. In conclusion, the changes that occur in our sexual health as we age are not something to be feared. Spermless ejaculation, including conditions like retrograde ejaculation, are simply part of the natural aging process. They do not indicate dysfunction or failure. Rather, they reflect the body's remarkable ability to adapt and evolve. It's important to address these changes with care, understanding, and an open heart, removing the stigma that often surrounds them. By doing so, we can create a space for honest conversations that provide comfort and clarity to those navigating these changes, allowing them to feel confident and empowered as they age. The emotional and psychological impact of these changes cannot be overstated. Aging brings with it not just physical transformations, but emotional and psychological challenges that can be difficult to navigate. One of the most significant areas where these challenges surface is in our relationship with our bodies, particularly when it comes to our health and sexual performance. For many men, the idea of losing the ability to ejaculate sperm, or experiencing any change in their sexual function, can create feelings of embarrassment, self-consciousness, and even distress. It's easy to feel as though these changes diminish your identity, or that they define you in a way that makes you feel less than what you once were. But I want to reassure you, these changes do not define your worth. They are simply part of the natural evolution of your body, and they do not have to dictate your capacity to experience intimacy or meaningful, fulfilling sexual relationships. In fact, the emotional connection and trust you share with your partner can become more profound as a result of navigating these changes together. While physical intimacy may evolve over time, it's important to remember that intimacy isn't solely about physical performance. It's about the deep emotional bond you share, the vulnerability you allow yourselves to explore together, and the trust you build as you face these changes with compassion and understanding. The anxiety and stress that can arise from concerns about sexual function can be alleviated through open, honest communication. Sharing your feelings with your partner and acknowledging that both of you may be experiencing this phase together can create a sense of closeness that transcends the physical. Let's take a step back and recognize an undeniable truth. Our bodies are in a constant state of flux. From the moment we are born, we are on a journey of continuous change, physically, emotionally, and mentally. Each day is another opportunity for growth and transformation. Aging is just one phase of this perpetual evolution. It is a normal, inevitable part of life. Our bodies evolve in ways that are often outside of our control, and this includes the way we experience intimacy and sexual function. For men, these changes often begin to surface in their 60s, marking a period when many experience shifts in sexual health. The absence of sperm during ejaculation, though initially unsettling, is often part of this natural progression. Although it may seem alarming to some, it's crucial to understand that this change, while noticeable, is usually not a sign of a serious health problem. Rather, it's a part of the aging process that occurs for many men. Spermless ejaculation, in particular, is most often the result of retrograde ejaculation, a condition that is surprisingly common. Retrograde ejaculation occurs when semen, instead of exiting the body through the urethra, is redirected into the bladder. While this may sound disconcerting, it is, in most cases, harmless and doesn't pose any significant health risks. It's a physiological adjustment that the body makes as it ages, and while it can understandably be frustrating or confusing, it is rarely a cause for concern. The causes of retrograde ejaculation are rooted in the changes that naturally occur in the muscles surrounding the bladder, neck, and urethra. These muscles are responsible for ensuring that semen is expelled from the body during climax. As we age, the strength and tone of these muscles naturally diminish, which can lead to the semen being diverted into the bladder instead of exiting the body. This shift is a direct result of the aging process, and while it can be surprising, it is not a medical emergency. It is, simply put, a natural change that many men experience as they grow older. It's important to keep in mind that this is not a reflection of your virility or manhood. It's simply a change that happens as your body matures. In addition to the natural aging process, medications can also play a significant role in changes to ejaculation. Men over the age of 60 are often prescribed medications to manage chronic health conditions such as diabetes, hypertension, and prostate issues. While these medications are essential for overall well-being, they can have unintended side effects, including impacting sexual function. Certain medications, especially those that affect the nervous system and muscles, can interfere with the body's ability to expel semen during orgasm. This is a well-documented, albeit lesser-known, side effect that can be distressing for men who are unaware of the connection. Medications commonly used to treat conditions. If you are still watching this video and find these lessons useful, please comment number 2 below to let me know that you are still watching this video with me. Like hypertension, depression, and prostate enlargement can alter the nerve signals or smooth muscle tone that regulate ejaculation. As a result, men may experience a reduction in the volume of semen released, or in some cases, complete absence of ejaculation. If you suspect that your medication is contributing to these changes, it is crucial to have an open discussion with your healthcare provider. Together, you can explore alternatives or adjustments that may help restore some of your sexual function without compromising your overall health. Surgical procedures designed to treat prostate issues can also lead to changes in ejaculation. For example, retrograde ejaculation is a known side effect of surgery such as prostatectomy, which is performed to treat benign prostatic hyperplasia, BPH, a condition where the prostate enlarges, leading to frequent urination and difficulty urinating. While procedures like prostatectomy are often effective in relieving symptoms of BPH and improving urinary flow, they can also have unintended effects on sexual function. These changes, while not uncommon, can be emotionally challenging for many men. It's essential to recognize that these changes are part of the trade-off when treating certain medical conditions. They do not indicate that something is wrong with your body or your ability to enjoy intimate experiences. Instead, they are a reminder of the intricate relationship between our health, aging, and sexuality. In conclusion, the changes that occur in sexual function as we age, including the loss of sperm during ejaculation, are a normal and natural part of life. While these changes may initially be disconcerting or even distressing, they are rarely a cause for serious concern. It's important to understand that your worth and ability to experience fulfilling intimacy are not defined by your body's changes. Open communication with your partner, understanding the role of medications and surgeries, and accepting the natural progression of aging can all help reduce anxiety and stress. By embracing these changes with openness and maturity, we can continue to experience deep, meaningful connections and intimacy throughout our lives. The changes brought on by aging are not always easy to navigate, especially when they affect such an intimate part of life as sexual function. When men experience a decrease in sperm during ejaculation or encounter retrograde ejaculation, it can bring up a complex mix of emotions. It's essential to approach this subject with sensitivity and an open mind because, while these changes may feel disconcerting at first, they are part of the natural cycle of life. They do not define who you are or the richness of the life you continue to live. It is, however, completely normal to feel embarrassed or self-conscious when confronting these shifts in our bodies, particularly as they relate to sexual intimacy, an area that holds emotional significance for many. Acknowledging the discomfort that may arise from such changes is the first step towards dispelling the fear and confusion that often accompany them. As men age, it is common to experience adjustments in sexual function, and while some may find these changes unsettling, it's important to understand that they are not always signs of a serious health issue. Rather, they are frequently the result of the natural aging process or the side effects of common health conditions and medications. It's crucial to remember that your worth and ability to form deep, meaningful connections are not determined by how your body performs sexually. The intimacy that defines a relationship is about so much more than the physical aspects of sex. It is about emotional connection, trust, and shared moments of closeness, which often deepen with age. The reality of aging is that our bodies change, sometimes in ways we don't anticipate, but these changes are not necessarily negative. They reflect the intricate, ongoing process of growing older. From the first breath to the last, our bodies are in a continuous state of transformation. As we move into our 60s and beyond, sexual function is one of many areas that can experience subtle shifts. Many men begin to notice these changes at this stage in life. The absence of sperm during ejaculation or the experience of retrograde ejaculation can initially seem alarming, but these phenomena are usually not as worrisome as they may appear. Retrograde ejaculation is one of the most commonly encountered conditions for older men. This term refers to a situation where, instead of semen exiting the body through the urethra, it flows backward into the bladder. Though this may sound alarming, it is typically harmless and does not pose any significant health risks. Understanding this is important, as it can ease the emotional distress that might arise from such a change. Retrograde ejaculation is usually a result of the weakening or loss of muscle tone in the bladder neck and the urethra as we age. These muscles play a crucial role in the normal expulsion of semen during orgasm. As they lose their strength, the semen can travel in a different direction, leading to the sensation of ejaculating without the release of sperm. However, retrograde ejaculation is not always the only factor at play. Many men rely on medications to manage chronic health conditions such as high blood pressure, diabetes, or prostate problems. While these medications are essential for maintaining overall health, they can also interfere with sexual function. Medications, particularly those that affect the nervous system or the muscles responsible for ejaculation, may cause semen to be expelled in smaller amounts, or in some cases, not at all. The reality is that many of these medications come with side effects that are rarely discussed in doctors' offices, leaving patients unaware of the potential impacts on their sexual health. It's important to discuss these changes with your healthcare provider so they can help you assess whether your medications are playing a role in these physical changes. In addition to medication, surgical procedures to address conditions such as benign prostatic hyperplasia, BPH, can also result in retrograde ejaculation. BPH is a common condition where the prostate gland enlarges, causing difficulties with urination. Surgical interventions like prostatectomy can alleviate the symptoms of BPH by reducing the size of the prostate and improving urine flow. While these surgeries can significantly improve the quality of life for many men, they can also lead to changes in ejaculation. Understanding this side effect can allow you to approach the situation with greater clarity and less concern, as the condition is generally not harmful to your health. Beyond the physical factors, hormonal changes also contribute to shifts in sexual health as we age. Testosterone, the hormone that is central to male sexual health, decreases naturally as men age. Testosterone plays a vital role in sperm production, libido, and overall sexual function. As its levels decline, it can lead to reduced sexual desire, a decrease in sperm production, and sometimes a drop in energy levels or mood. These changes are natural and to be expected as part of the aging process, but they can still cause distress, particularly when combined with other physical changes. Low testosterone is not usually the primary cause of retrograde ejaculation or the absence of sperm during ejaculation, but it can influence sexual performance in general. For men experiencing concerns related to low testosterone, consulting with an endocrinologist can provide insight into whether hormone levels are contributing to sexual changes. Blood tests can evaluate testosterone levels and determine whether they are within a healthy range for a man's age. If necessary, hormone replacement therapies or lifestyle modifications may be recommended to help restore balance, which could improve libido, sexual function, and overall quality of life. The emotional and psychological impact of these changes is equally important. It's natural to feel anxious or self-conscious when confronted with shifts in sexual health, especially when those changes may affect intimate relationships. These feelings are completely normal and part of the broader experience of aging. It's important to acknowledge the mental and emotional aspects of these changes because they can significantly impact sexual satisfaction. Worries and fears about aging can lead to performance anxiety, which in turn can affect sexual pleasure and intimacy. This is where communication with your partner becomes key. Sharing your feelings and concerns openly can not only relieve stress, but also deepen the emotional bond between you both. Open dialogue with your partner fosters mutual understanding and support. Instead of harboring feelings of embarrassment or shame, discussing these changes can reduce anxiety and create a space for reassurance. Many couples find that their sexual relationship can grow even stronger as they age, as intimacy shifts from purely physical to a deeper emotional connection. It's also important to remember that physical intimacy isn't the only form of connection that matters. The emotional closeness, trust, and affection that you share with your partner can provide a sense of fulfillment and satisfaction that goes beyond the physical act of sex. In conclusion, while changes in sexual function, whether through retrograde ejaculation, low testosterone, or the natural aging process, can feel unsettling, they are a normal part of the aging journey. These changes do not diminish your worth or your ability to enjoy meaningful, intimate experiences. By seeking medical advice, engaging in open conversations with your partner, and taking steps to maintain both your physical and emotional health, you can continue to experience rich, satisfying relationships as you grow older. Embracing these changes with a sense of understanding and acceptance can help ensure that your intimate life remains fulfilling, vibrant, and full of connection. As men age, they often experience a range of physical, hormonal, and emotional changes that can impact their sexual health and overall well-being. However, there are many ways to address these changes and maintain not only physical health but also emotional confidence. Lifestyle changes, such as increasing physical activity, eating a nutrient-rich diet, and reducing stress, can significantly help regulate hormones and improve overall health. These changes don't just benefit the body, they also play a key role in preserving emotional and psychological well-being. Exercise, in particular, has been shown to improve circulation, reduce stress, and enhance mood, all of which contribute to better sexual health. Dietary adjustments, focusing on foods rich in vitamins, minerals, and healthy fats, also support hormone regulation. Nutrient-dense foods, including those rich in antioxidants, zinc, and omega-3 fatty acids, promote healthy testosterone levels and improve circulation, which is essential for sexual function. In addition, practicing stress reduction techniques such as mindfulness, yoga, or meditation can reduce the impact of daily stressors, which are often linked to a decrease in libido and other sexual health concerns. All of these lifestyle adjustments combined can help regulate hormones and enhance a man's overall vitality. For some men, hormone replacement therapy, HRT, may be an option to consider, but it is crucial that this therapy is only pursued under the supervision of a healthcare professional. HRT can help balance testosterone levels and alleviate symptoms of low testosterone, such as reduced libido, fatigue, and difficulty achieving or maintaining an erection. However, it's important to recognize that hormone replacement therapy is not a one-size-fits-all solution and comes with its own set of risks and considerations. A thorough consultation with an endocrinologist or a qualified medical professional is essential before embarking on any form of hormone therapy. If you are still watching this video and find these lessons useful, please comment number 3 below to let me know that you are still watching this video with me. Understanding and managing these physical and hormonal changes can significantly empower men to not only maintain their health, but also regain their confidence in intimacy. This empowerment comes not just from physical changes, but also from recognizing the important role mental and emotional health plays in sexual health. The connection between the mind and body is incredibly intricate, and emotional states such as stress, anxiety, and self-doubt can significantly impact physical responses during intimacy. When a man is anxious about perceived deficiencies in his body or performance, it can create a feedback loop that exacerbates the problem. Performance anxiety, particularly related to aging and changes in sexual function, can lead to a decrease in sexual activity over time. A man who is worried about disappointing his partner or himself may avoid intimacy altogether, which can further strain relationships and negatively affect self-esteem. These feelings are completely natural, and it's important to acknowledge them as part of the broader emotional experience of aging. It's also important not to fall into the trap of believing that these feelings signal weakness or inability. They are simply a sign that the individual may need additional support and understanding. One of the most effective ways to address these challenges is through open and honest communication with a partner. Expressing feelings, concerns, and fears allows both individuals to understand each other more deeply. This creates an emotional connection that transcends the physical aspects of intimacy. By talking about vulnerabilities and uncertainties, a couple can foster intimacy that is rooted in trust, respect, and empathy. This type of communication can significantly reduce anxiety and prevent negative thought patterns from interfering with sexual performance and overall relationship satisfaction. For men who are struggling to navigate these emotional complexities, seeing a sexual health therapist can provide invaluable support. Sexual health therapists specialize in helping individuals and couples overcome challenges related to sexual intimacy, including issues stemming from aging, hormonal changes, or performance anxiety. These professionals can provide strategies to manage anxiety, improve communication with a partner, and rebuild confidence. Therapy can also offer insights into how to approach intimacy in ways that nurture emotional connection, helping men and their partners feel more fulfilled and satisfied in their sexual relationships. At the heart of it all is the understanding that intimacy is about more than just physicality. Emotional closeness, trust, and mutual respect are the true foundations of a strong and lasting sexual relationship. As men age and experience changes in their bodies, it's crucial to remember that these changes are part of the natural process of growing older. Feeling vulnerable or uncomfortable is completely natural, and these feelings are shared by many individuals at similar stages of life. There is no reason to judge oneself harshly or to feel inadequate. Instead, it's important to embrace these changes with a sense of compassion for oneself and a willingness to adapt to the evolving nature of intimacy. Aging doesn't have to diminish the quality of a man's sexual relationships. In fact, many couples find that as they age, they are able to enjoy deeper emotional intimacy and a stronger sense of connection, even if physical intimacy may change. By focusing on open communication, seeking professional support when needed, and practicing self-compassion, men can continue to experience fulfilling sexual relationships throughout their lives. Every stage of life presents its own challenges, but with the right mindset, these challenges can become opportunities for growth, connection, and deepened emotional intimacy. Thank you so much for watching. We've explored a lot today about relationships, aging, financial wisdom, and emotional resilience. But before we wrap up, I'd love to hear from you. What's one thing you've learned so far that really stood out to you? How will you bring it into practice in your life? Please share your thoughts in the comments below. If you like this video, don't forget to leave your comment, give it a thumbs up, and share it with someone who might find it helpful. And make sure to subscribe to our YouTube channel so you never miss out on more insightful content. Take care and remember, your well-being and happiness matter, no matter your age.